We can have all the fancy devices and machines and CVVH and drugs that we want, but if we just save the person's life but we don't restore the person's life, what have we really done? A big part of my career is the study of the role nutrition can play in improving outcomes in critical care patients, both in preparing them for, say, surgery or the ICU, and in recovering patients from the ICU. We must ask ourselves, with all the technology and all the money we spend in the ICU to save people's lives, are we really creating survivors? Are we creating victims? Although we have halved the mortality from sepsis and other forms of critical illness in the last 10 years, we at the same time have tripled the number of people going to rehabilitation. 60 to 80% of the patients that leave our ICU, say after a week on a ventilator, will have serious physical and cognitive impairments. Nutrition plays a key role in the recovery of the ICU patient. Lean body mass or muscle mass is essential to all of those things. Without restored lean body mass and muscle function, patients can't go up the stairs, they can't go to the store, they can't walk down the street with the people they love. We really need to be personalizing our nutrition. We need to be giving the right nutrient to the right patient at the right time. We are learning now that perhaps in the first 1 to 3 days of critical illness, the acute phase we call it, we probably should be giving less calories to the well-nourished patient. We also are finding we should only be giving maybe 0.8 grams per kilo per day, or maybe less than just under 1 gram per kilo per day of protein for the first 2 to 3 days. As the patient begins to get into the recovery or chronic phase, after day 3 to 5, we know our patient's energy needs go up enormously, 3,000 or even 4,000 calories. And clearly we know 1.5 to 2 grams per kilo per day of protein is essential to not only optimize clinical outcome, but to give us the best chance of improving quality of life outcomes. 3 and 6 months later, we have data from the Redox trial that shows that patients who were fed more protein and calories in that first 8 days more effectively had much better quality of life scores at 3 and 6 months. So how you feed in those first 8 days seems to change a patient's function and quality of life months and probably years later. And so we need to help our patients overcome this through a multimodal approach that includes the basic protein. The building blocks of muscle has to be there. So protein delivery is essential. Without that, nothing else moves forward. And then HMB, hydroxymethylbutyrate, is a derivative of leucine that has been shown to increase lean body mass and is showing great promise to help restore muscle function and restore lean body mass. Restoring lean body mass and maintaining lean body mass and muscle function in patients should be goal number 1, right next to making sure they live, because if they don't restore and maintain their lean body mass, are they really living at all?